This is Med School Radio. Let's talk about ANCAs. Which ones are in which type of vasculitis? So today's PathBite is about a topic mentioned briefly at the end of Monday's PathBite, anti-neutrophil cytoplasmic antibodies, or ANCAs. These antibodies are present in some patients with certain types of vasculitis, and they can be an important part of both diagnosis and follow-up. It seems strange when you think about it to have an antibody against some antigen that is hidden away in the cytoplasm of another cell. But it turns out that the specific antigens targeted by these ANCAs might not always stay put in the cytoplasm. Neutrophils may also express these antigens on their cell surfaces, either all the time, in very small amounts, and or in times of activation or apoptosis, in large amounts. Okay, now it makes sense. There are a couple types of ANCAs relevant to this discussion. There are other types of ANCAs that are present in other diseases, but we won't get into that here. It's important to know that these two types of ANCAs, because they are seen in different types of vasculitis, ANCAs used to be classified according to the location of the corresponding antigen within the cell. Cytoplasmic or C ANCAs or perinuclear P ANCAs. You'll still hear them referred to this way, but more and more they will be referred to based on the target antigens themselves. So the first one, anti-proteinase 3 antibodies, PR3 ANCAs. These are the same as C ANCAs. And next, anti-myeloperoxidase antibodies, or MPO ANCAs. These are the same as P ANCAs. Personally, I like the C ANCA, P ANCA better, but nobody knows, nobody asked me about these things. You should know which diseases are associated with each type of ANCA. PR3 ANCAs, or C ANCAs, are commonly present in granulomatosis and polyangiitis, and MPO ANCAs, or P ANCAs, are commonly present in microscopic polyangiitis, and sometimes present in Churg-Strauss syndrome. Note that it says commonly, and sometimes above. I don't want to get into exact percentages. These vary depending on which article or book you look at. But I want to make the point that although these ANCAs are present, even frequently present in these diseases, there are some patients with these diseases who do not have them. So the presence or absence of PR3 ANCA, for example, does not rule out the presence of granulomatosis with polyangiitis. Let me read that again. So the absence of PR3 ANCAs, for example, does not rule out the presence of granulomatosis with polyangiitis, especially if all other signs point towards the disease. So that was very interesting. We learned something about ANCAs. And if you want to read more, go to Robbins, 9th edition, page 506.